Hello there. Welcome to the webinar today, which is part of our new Living Well with Myeloma series. And this is our first one in the new series, and we have 3 currently set up to run, with another 9 for next year. So if you're interested in those, then please register for those as well at myeloma.org.uk/webinars. And they are at the end of November and the middle of December. And that's all from me, so I'm going to pass over to Ellen to talk to us about coping with myeloma-induced fatigue and to tell us a bit about herself. Ellen.
Thank you, Kyle. Thank you. Yes, I'm Ellen Waters, so I'll introduce myself a little bit before I get started about talking a little bit about fatigue. So I'm one of the nurses here at Myeloma UK, and my main job here is to answer our free phone helpline, the Myeloma info line. I answer that info line with my colleague Jill, and we're both trained nurses and have been for many years. And whilst I personally have never experienced fatigue, it's something that I talk about every day on the info line, so I get lots of insights from patients, family members and friends. So hopefully today I'm going to cover what fatigue is, look a little bit into what fatigue actually is. I'll discuss and explore what the symptoms and the causes of fatigue are, and the treatment of fatigue as well. And as Kyle says, I'm happy to answer any questions at the end. So, looking a little bit more at what fatigue is, and we know from research that it does affect about 70% of patients at some point in their myeloma journey. And in fact, Myeloma UK did a survey, and we found that 88% of people said that it made their lives more difficult. So as I've said, I personally haven't experienced fatigue, so it's not just tiredness that you get day to day working in a busy job. It's an overwhelming tiredness. It can be very debilitating and not relieved generally by sleep or by naps. It's not just a physical symptom, it also has psychological and emotional elements as well, which I'm sure a lot of you will be able to relate to. Most patients tell us that it's a very frustrating symptom. You want to get on and do things, but the fatigue just doesn't allow that. In fact, many patients tell us that it's one of the most debilitating factors about living daily with myeloma, even over pain in some cases. And we know that pain is a very common symptom in myeloma. So what are the symptoms of fatigue? Well, like everything to do with myeloma, it is very individual, and some people describe some or all of these symptoms you see here on the screen. It certainly is a lack of energy, a weakness, and it also has a cognitive element, so it's not just a physical tiredness. People describe being unable to think straight, being unable to concentrate, finding it difficult to carry out complicated thinking. And it can be also a bit of a feeling of disorientation, and your memory is not so good either. People also describe mood swings, predominantly low mood, and feel quite irritable, often, unfortunately, with those closest to them. And that's why we say that it affects the whole family, not just the patient, because certainly family members, friends are affected by everything to do with the patient's diagnosis. We know that from speaking to people on the info line, that they tell us that their emotions are all over the place. They cry easily, get very tearful and upset at the slightest thing. And again, a lot of that is to do with the frustration of it all. And we know that it can affect closeness within your personal relationships. So people do say that they have reduced sexual feelings and a poor sex drive, and it does affect day to day getting on with those that you love. So the causes of fatigue, again, very individual. It's often a combination of factors. We wouldn't say that it was particularly down to one thing. It's more than likely more things, more than one factor playing a part at once. Probably the most common cause is anemia. And we know that anemia is very common in myeloma, and that's caused by the myeloma itself. The myeloma cells multiply out of control in the bone marrow and produce these chemical signals which are called cytokines, and those can have an effect directly on how the bone marrow does its job. And one of the jobs, the main job of the bone marrow, is to produce healthy blood cells. So anemia is actually defined as a low hemoglobin, and that's the test that's done at the hospital to determine how anemic you are. So the hemoglobin is the oxygen carrying capacity of red blood cells, and it's those that supply oxygen to all our tissues and all our organs affected directly by the myeloma and by many treatments as well. Some people are quite symptomatic at the least fall in their hemoglobin, so you can just have a very slightly low hemoglobin and feel very symptomatic, whereas others don't have any symptoms at all, and unless it falls really very low. Another cause can be poor nutrition. We know that to cope with the day-to-day living with myeloma and its treatment, you need to be in the best physical condition, and nutrition plays a big part in that. And we know that often when you're on treatment, it affects your appetite. The psychological and emotional effects day-to-day affect your appetite. You just don't feel like eating, or foods taste differently, especially when you're on treatment, and that certainly is the case. Anemia can also be caused if you have poor kidney function, and again we know that myeloma can commonly affect the kidneys. One thing that kidneys do is they produce a hormone called erythropoietin, and that's produced in response to low levels of red blood cells. So you can imagine that if your kidneys are affected, then they won't be producing this hormone that boosts the supply of red blood cells. And erythropoietin is not produced as well in people with impaired kidneys. Other causes of fatigue, we've mentioned that it has a psychological and an emotional effect, and we've also mentioned that pain is common in myeloma. Myeloma affects the bones, there can be pain, and sometimes it's a bit of a vicious circle. You're in pain, you feel more fatigued, you feel more pain, you feel more fatigued, so it can be a bit of a vicious circle. So these are all things that should be taken into account when looking at myeloma-related fatigue. So looking at the treatment of fatigue, again, it very much depends on what's causing the fatigue. As we've said, the myeloma itself can cause anemia and related fatigue. So we often find that once treatment successfully gets on top of the myeloma, reduces its bulk, this often results in an improved quality of life. Certainly blood transfusions play their part, and if someone is quite acutely anemic on treatment, then a blood transfusion is a bit of a quick and a temporary fix. It works very well, but it's not long lasting. And hopefully, once the myeloma is brought under control, our bodies will respond to that and begin to recover from the effects of the myeloma. If someone is long-term anemic, then there is we can give erythropoietin in the form of an injection to help with that, and that's a bit of a longer-term treatment, longer term than blood transfusions, for instance. We talk about diet, so if your diet isn't good, and particularly if you're losing weight, then referral to a dietitian is often appropriate. Speak to your doctors, speak to your nurses if you are fatigued. Doctors and nurses aren't necessarily as aware that fatigue can have such a debilitating effect. They often think that perhaps pain is the thing that has the most debilitating effect for patients, but we know that that's different, that fatigue probably is the biggest factor to play. Speak to your family and friends. If they say, can we help, they often mean it, so take them up on it, and speak to your team and be quite vigilant about your symptoms and about reporting them. I know that many patients find it very helpful to keep a diary, for instance, and keep a diary of your symptoms, keep a diary of your blood test results, so you can see that perhaps your hemoglobin is falling, perhaps, and you're becoming more fatigued, and you can marry those two up. And also, fatigue is something that you can often identify times of the day when it's at its worst. So for instance, if through keeping a diary you discover that your fatigue is worse in the afternoon, perhaps plan your day to get your tasks done in the morning, or vice versa. But we would always say it's not something that you have to put up with. Please do report any signs and symptoms to your doctor or nurse. They will often want to help and may be able to suggest something to help. And also don't underestimate the physical and psychological importance of being in a good place emotionally. So if you feel you want to speak to someone, there may well be counsellors available. And we also know that from research that regular gentle exercise certainly is very good for getting on top of fatigue, and research has shown that a regular exercise program in fact helps to reduce fatigue. So if you can manage to do something gently, bearing in mind that where you are with regard to your myeloma and its treatment, but if you can do something regular, gentle exercise, then certainly you'll be doing yourself a big favour. And of course we have many resources at Myeloma UK to help you find out more about fatigue, to help you live day to day with the impact of it and other symptoms and complications of myeloma. We have an info guide specifically on fatigue, which I send out to patients every day when they speak to me on the helpline. And we have a Living Well essential guide, which looks at the day-to-day practicalities of living within myeloma, and including how to manage fatigue and exercise and things like that. So I'm happy to try and answer any questions that there are.
Excellent. Thank you, Ellen. So we have had quite a few questions in already, and if you do have a question, then feel free to send it through just now. And while we're doing the first four or five questions that we've had in, we can add that in if we have time.
Okay.
So let's go to the first question now. So this is from Carol, and she says, I'm 3.5 years post-stem cell autograft and in remission, but I do get days when I'm just fatigued, even though all my blood results are good. I'm wondering if others feel the same, and if this fatigue is related to mild depression or anxiety due to the enormity of what we have been through and what we face in the future. So could you maybe answer that question for Carol?
Sure, absolutely, Carol, yes. And it certainly does have an effect, the mild depression and anxiety. And I speak to patients every day who tell me that they're in good remission, their myeloma is well under control, and yet they do have off days. And I think it's important not to beat yourself up for having off days. It certainly does happen. You're absolutely not alone. And it is an enormous thing that's happened to you, that you're in a different place since you were diagnosed. Everything's changed in your life. You're not the same person you were before diagnosis. And as I said earlier, don't underestimate the psychological and emotional response to being diagnosed with myeloma, to having treatment for myeloma. It can have an effect, and that will certainly not help with fatigue. But again, it doesn't do any harm still to mention it to your doctor or your nurse that this is something you're having intermittently, and they will just double check that there's no physical reason for it. And if you wanted to speak to a counsellor, that could be arranged as well.
Okay, thank you, Alan, for that. We have another question from Joe, who said, when in full remission, do you still have myeloma symptoms like fatigue, or in theory, are you just well throughout the remission?
Yeah, that's a good question as well. In theory, when you're in remission, your myeloma is at as low levels as it possibly can be. And we know that we do know that many patients say that their quality of life does improve at this time. But in reality, we also know that it is still sometimes a bit of an issue, and people do have the odd day where they're just not feeling up to it. And it's common to have the odd off day, and don't. As I say, don't beat yourself up about that. Maybe keep a diary. There may be a bit of a pattern. It's a good idea to keep a diary and still mention it to your doctor or your nurse. And as I say, they may well be able to investigate further to see if there's any physical cause. But it's not unusual. I do hear about it. Yeah.
Okay. Next question is from Murray. And Murray says, I do suffer from fatigue following a very recent stem cell transplant. It has been suggested to me by a friend that an alternative therapy called, sorry, I won't be able to pronounce that properly, spirulina might help. Do you have a view on this? Okay.
Well, certainly the days after a stem cell transplant are the days that patients are more susceptible and more prone to fatigue. And that is the one thing that patients tell us takes the longest to recover from after a stem cell transplant. Again, like everything else, it's different for everyone. Some people are up and fully recovered after the transplant and feel much, much better within weeks or even a few months. For others, it can take up to 5 or 6 months before they feel back to that level of normality. I haven't heard of spirulina, and we always say with supplements that if you wanted to try something like that, as long as you run it past your nurse specialist or your hematologist, that's absolutely fine. But there are no, as far as I'm aware, there's no stringent clinical research to say that these supplements can help with either myeloma or its symptoms and complications. So I can't really comment on that. But if it's something that you wanted to try, please do just speak to your doctor or your nurse.
Thank you. Okay, the next question we have is from Susan, who asks, I've been told to exercise. Now, you mentioned this during the talk, but Susan's asking, does this make sense? Wouldn't that make me more tired?
It's a good question, Susan, yes. You would think, wouldn't you, that exercise makes you feel tired, but it's a normal, healthy tiredness. It's not the same sort of tiredness that's related to fatigue. And actually, it's not just something that we pluck out the air saying that exercise is good for your fatigue. It is something that's been researched fairly thoroughly, and it has been shown that regular gentle exercise, walking every day, cycling is also very good. We wouldn't recommend things like load-bearing exercises that might have a bit of too much of an impact on your bones, especially if you've got some bone damage caused by the myeloma. But things like walking and cycling, absolutely. And again, keep a diary and try and increase that gently as you go along. Of course, if during any exercise you feel any pain or feel particularly unwell, stop what you're doing and speak to your doctor. But yes, exercise actually is good for fatigue. Yeah.
Thanks, Ellen. Okay, next question then is from Godfrey, and we've got two questions from Godfrey actually, but the first question is, does CBT help overcome the fatigability associated with myeloma?
It can do, especially if it has a psychological root or emotional root. Obviously, the physical reasons why you're fatigued, anemia for instance, would more than likely be improved by improving that anemia. But if your fatigue is down to psychological or emotional issues, then CBT or cognitive behavioural therapy is very, very helpful. In fact, cognitive behavioural therapy certainly is one of the NHS interventions of choice for depression, for anxiety. So if you wanted to speak to a counsellor who specialises in CBT, once it's been determined that your fatigue isn't due to a physical reason, then absolutely you can either speak to a cognitive behavioural therapist privately, or if your hospital has a counsellor who specialises in CBT, ask for a referral. Yeah.
And just on that question, just to say that Marilyn had asked a very similar question about tips for helping with cognitive difficulties.
Yeah.
So just to say, Marilyn, I hope that's answered your question as well.
Absolutely, absolutely.
Okay, and I said there was another question from Godfrey. So he also asked what specific type of diet is recommended to help with fatigue.
Okay, so again, in myeloma, there's no particular diet recommended. A well-balanced, healthy diet. People often ask, what is a well-balanced, healthy diet? Well, that's just a diet which contains all of the food groups, so proteins, minerals, vitamins, vitamins and nutrients that let you be in the best physical condition. So we wouldn't say anything specific, but perhaps replace heavy fats or carbohydrates with more salads or vegetables or fruits and things like that. And especially if you're on myeloma treatment, particularly steroids, I have to say, can increase your sugar level. And that's a bit worrying for someone who perhaps already has diabetes or pre-diabetes. So we would say try to replace some of the bad sugars with good diets, and increase your vegetables. The most important thing, I think, and we would always say, is to try and drink plenty of fluids. So we would recommend 2 to 3 litres of fluids on a daily basis. It's good to keep your kidneys flushed. And if your kidneys aren't working as well as they should be, one of the main jobs of our kidneys, over and above producing erythropoietin that I talked about earlier, is to rid the body of toxins. And if you're retaining those toxins, certainly that can contribute to feeling more and more fatigued. So no particular diet, but certainly a good fluid intake is certainly recommended.
Thanks very much. Next question then is from Graham, who is referring to Carol's question earlier, the very first question we had. And Graham says, I too am 4 years post SCT and fatigued. Does that mean I'm depressed, or is there a physical cause to my fatigue and general unfitness?
Yes, that's a good question as well. And certainly if there were a physical cause, I'm sure your doctors and nurses at your clinic would be able to identify that. And a physical cause is usually anemia. So you will be able to ask what your hemoglobin levels are, and there is a normal level. So if you're anemic, then certainly that would be the most likely physical cause. Often people say that if you were depressed you would know about it, but that's not always necessarily the case. You can be low in mood kind of continuously without feeling that you're clinically depressed. And yes, unfitness may well play an impact. I mean, exercise doesn't just have physical benefits. It also has emotional, psychological benefits too, and it improves your feelings of well-being. So if you can perhaps turn around your unfitness a little bit, and slowly and gradually, you may notice an improvement in your fatigue. And if you do feel that you're perhaps depressed, then speak to someone at your clinic. It may be that speaking to a specialist would help you to identify that. And again, keeping a diary often helps with that as well. So yes, good question.
Okay. Next question's from David, who says, to what extent is fatigue caused by the chemo drugs rather than the myeloma disease itself?
Good question. Yes, certainly. It's often a combination of things, and when you're on treatment, there are certain treatments that are more likely to cause fatigue. For instance, chemotherapy itself, and when we talk about chemotherapy, often we mean the high dose chemotherapy used during a stem cell transplant. Chemotherapy particularly targets fast dividing cells, and that's what myeloma cells are, but it's also the healthy cells within the bone marrow. And there are other chemotherapies over and above that you would have during a stem cell transplant that is used in myeloma. Melphalan, for instance, is a chemotherapy that's used, can be taken in tablet form. Cyclophosphamide is chemotherapy as well, as is bendamustine, and all of these chemotherapies can cause fatigue. Other drugs which also we found can particularly cause fatigue are things like the IMiDs, the immodulatory drugs such as Revlimid or lenalidomide. It can certainly fatigue is one of the common symptoms of one of the common side effects of lenalidomide. And thalidomide, which is the first IMiD, has sedative effects. So it was initially used way back in the 50s and 60s as a sedative type drug. So it causes sleepiness. So we would say if you're on thalidomide, take it in the evening before you go to bed, an hour or two before you go to bed. Some patients say that it helps them get a good night's sleep, but they often feel a bit groggy in the morning. But yes, certainly the drugs used to treat myeloma can cause fatigue as well as the myeloma itself, yes.
Okay, there's another question on a similar topic which I'll just try and find, so just bear with me a second.
Okay.
Okay, this is from Paul, and I just thought I'll pull this one out just now, because it says, if my treatment is contributing to my fatigue, can I reduce the dose? If I do that, it might be less effective against the myeloma, which may also be causing fatigue. Absolutely. So I guess it's the balance of the two that Paul's trying to know.
Absolutely, Paul, and it is a concern that many patients have, and that's why often they don't report their fatigue, because they worry that the treatment will just be stopped. And if it's having a good effect on the myeloma, then that's absolutely what they don't want. But it's not necessarily the case. As Kyle has said, it is a bit of a balance to be had between getting on top of the myeloma without causing too many other problems. So speak to your doctor or your nurse. The dose can be reduced. It might not necessarily have less an effect on the myeloma, but it is a bit of a fine balance to be had. But don't think that just because you're experiencing side effects from treatment that the doctors will just stop the drug. They won't do that. They will try and get a bit of a balance to be had here.
Okay, so we've got a couple more questions. If there are, if you do still have a question, then please do just put it in the questions tab, and that'll come through to me. But there's just a few more, I think, before we'll wrap up just now. So this one's from Marianne, who says, since being diagnosed with myeloma, I've been very anxious and not sleeping well. This makes me tired. Is there a link with this and fatigue?
Yes, Marianne, there certainly is, and we've said that fatigue does have psychological and emotional factor indeed, and again it's a bit of a vicious circle. The more fatigued you feel, the more anxious you feel, the more anxious you feel, the more fatigued you feel. So many people feel that they're just not getting out of that bit. Yeah, we do recognise that anxiety is a very common reason for people to feel more fatigued. So again, I would always say speak to your doctor or nurse, or speak to other patients and families. You know, many times it's useful to go along to a support group, for instance, to realise that you're not alone in how you feel, and attending a support group, you can share experiences with other patients, or you know, speaking to others on the discussion forum on our website, for instance. You'll hear that you're not alone in those feelings, and that sometimes helps to realise that. that. So it's a good question, and there is a link, definitely. Yeah.
Okay. This question is from Ian, who says, I take a low dose of morphine every day for my back pain, which I presume causes my fatigue. Do I just have to accept there is nothing I can do about this?
No, you don't have to accept that. Morphine, yeah, absolutely. It's an excellent painkiller. It works very well, and many patients do need to be on morphine-related painkillers to get on top of their pain. But it does cause tiredness, drowsiness, and again, as I mentioned earlier, there is a bit of a balance to be met. There are lots of different types of painkillers, so if one isn't suiting you, then please do speak to your doctor or nurse, and it may be that a different type of painkiller would be more effective or just as effective against the pain, but without causing too many issues with increased fatigue. And if your pain isn't being managed very effectively or the balance isn't being met, then there are healthcare professionals who are pain specialists, and that's what they do day in, day out. And your haematologist may refer you on to a pain specialist. You might hear them called palliative care experts. And I know that when I mention the term palliative care, a lot of people worry that we're talking about end-of-life issues. It's not the case. Palliative care experts are experts in pain control, in fatigue control, in shortness of breath, any symptoms or complications of myeloma. They can sometimes think of something that perhaps the doctor hasn't thought of. So if you do need to be referred to a specialist for your pain, then do speak to your doctor about that. It certainly is something that can happen. Yeah.
Okay, thanks very much for the question, Ian. And the next question is from, oh no, sorry, we've had that one, you jumped ahead. This one's from Carolyn, who says, I'm experiencing quite disabling fatigue and cognitive difficulty at the asymptomatic stage of myeloma. Is this to be expected, and are there likely to be periods of recovery?
The fact that your fatigue, Carolyn, is disabling, and you're obviously finding it very, very difficult, not just physically, but mentally as well. I do think it's something that your doctor will want to know about. Asymptomatic myeloma is just that. There shouldn't really be any symptoms. So your doctor will want to thoroughly investigate whether or not there is a physical cause for your fatigue. And of course, not everything that happens to you when you're diagnosed with myeloma is necessarily related to myeloma. So there may be other reasons why you're experiencing this. But, what I would say is don't suffer in silence. Do let your doctor or nurse know that this is actually quite disabling for you. And they may be able to investigate it further. Yeah.
Okay, excellent. Thank you. Another good question. The next one is from Patricia, and it's a bit similar about being asymptomatic and symptomatic. So is there an average time between being asymptomatic and symptomatic, and how does one tell the difference between what one may think is tiredness due to everyday activities and fatigue? So that's a great question, and also similar to the last question, is fatigue a symptom?
Yes, it is. But to answer your first question, Patricia, and the average time between being asymptomatic and symptomatic, it's difficult, if not almost impossible to know. It's very, very individual. And for patients diagnosed with asymptomatic myeloma, what is important is that they're monitored very closely by their haematologist to catch any progression between asymptomatic and symptomatic. And that's why you will be monitored probably on a monthly basis for that. The difference between day-to-day tiredness and fatigue is just as I've said. It is quite different. I personally, I'm tired on a fairly regular basis, and you get tired when you've been for a long walk, or or if you're working and you've had a busy day at work. But the fatigue due to myeloma is actually quite overwhelming, and patients can say it stops them in their track. as I say, it also has a kind of cognitive factor as well. So not only are you physically completely overwhelmed, cognitively you can be overwhelmed as well and not able to think straight. Patients say it's like walking through treacle, everything's slowed down, and you would notice the difference, I think, if you experience that. But again, really important to maybe keep a diary, to be quite vigilant about symptoms and reporting them to your doctor or your nurse.
Okay, thanks very much, Ellen. The next question is, I've not started any treatment, but I'm always tired. I'm worried that when I start treatment, about how tired I will get.
Okay, so I'm guessing because you've not started any treatment yet, that you may well be in this asymptomatic stage of myeloma. And again, it possibly has a psychological reason, the fact that you've got this diagnosis where there is no treatment, and many patients tell us that having asymptomatic myeloma has a huge psychological impact. You've been diagnosed with this condition, you've been told there's no treatment at this stage, you will be monitored, and that at some point it will progress to a stage where you will need treatment. And that can play havoc with your emotions, and that in itself can cause tiredness and fatigue. I mean, it's difficult to know really, to try and predict if that will get worse if and when you do start treatment. The chances are it may well do, but on a temporary basis, and it may well improve once things are brought under control. So, but it is difficult to know for sure. But this stage before treatment certainly is a stage where your emotions can be all over the place.
Okay. And I think this is the final question, unless we get any more popping in while we answer this question. So thanks for the questions, everyone. And the last question is from Stanley, who says that sleeping is a problem, especially after taking steroids. How do you feel about long-term sleeping tablets?
That's a good question as well, Stanley, and one that I have been asked on the helpline, on the info line. There are things you can do to get into a good sleeping pattern. It's really important to try and build up a bit of a routine if you can. We would say things like always go to bed at the same time, try to sleep in a dark room where you're not interrupted by noises or lights. Don't have any stimulants before you go to bed, like or alcohol or caffeine. Lots of cups of coffee. Have a hot milky drink, perhaps, and trying to get yourself into that sort of routine. It doesn't happen overnight, I'm afraid. It can take some time to build that up. And steroids, I'm afraid, are they do cause you to have sleepless nights, but that's why we would always say, if you're on steroids, take them in the morning, take them after your breakfast, and that way hopefully they won't affect your nighttime routine or your sleeping pattern. Sleeping tablets do have their place, perhaps not long term, but certainly as a temporary fix. And sometimes patients only need them for a short time to get themselves into that routine, and then they can slowly but surely wean themselves off them. They do have their place. There's nothing wrong with asking about sleeping tablets, but just make sure that you've explored other options, that you've looked at your sleeping routine, that you've looked at the environment you sleep in, and that you are taking your steroids in the morning.
Okay, excellent. Thanks very much, Alan, for that, and thanks everyone for your questions. What we'll do is we'll just finish up there. I just want to point out that Myeloma UK resources, again, as Ellen mentioned in the beginning of the presentation, you can get these online, or you can order them by phone or by email, so please do that. They're completely free, but they're great things to have available for when you have questions. You might not have a question just now, but you might have one later on and can look to those guides. On that note as well, then you might not have had a question just now, but you might think of one this evening. or tomorrow, and if so, then please feel free to call the info line. Ellen and the team on the info line will be more than happy to answer your questions, and you can send in questions via email as well if you'd rather do that to askthenurse@myeloma.org.uk. And finally, again, if you've enjoyed this webinar and want to attend the next ones, then please you can register now at myeloma.org.uk/webinars for the next 2 webinars to register there to attend the next ones. And thank you very much for attending. That's it from us. Thank you.
Thank you.